10 Health Consequences of Excess Drinking and How to Overcome It. Anything in excess is not good for your health. Much like many other things, drinking in moderation is fine, but excess drinking can affect your health negatively. According to the Dietary Guidelines for Americans, moderate alcohol consumption is defined as having up to 1 drink per day for women and up to 2 drinks per day for men. In the US, 1 drink is usually considered to be 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits, hard liquor, such as gin or whiskey. Heavy drinking constitutes more than 3 drinks on any day or more than 7 drinks per week for women, and more than 4 drinks on any day or more than 14 drinks per week for men. However, many people do not follow this rule and end up drinking more than they should. Nearly 88,000 people, approximately 62,000 men and 26,000 women, die from alcohol-related causes annually, making it the 4th leading preventable cause of death in the U.S., according to the National Institute on Alcohol Abuse and Alcoholism. Also, alcohol-impaired driving fatalities accounted for 9,967 deaths, 31% of overall driving fatalities, in 2014. Looking at these figures, it is important to consider whether you are drinking in excess and what you can do to cut back or quit entirely. Here are the top 10 health consequences of excess drinking. 1. Causes liver disease. Long-term heavy alcohol use is the most prevalent single cause of illness and death from liver disease in the U.S., according to the National Center for Health Statistics. Heavy drinking takes a toll on the liver and can lead to a variety of liver-related problems, such as fatty liver disease, alcoholic hepatitis, fibrosis, and cirrhosis. Excessive alcohol can even lead to an increased risk of liver cancer. Women are particularly vulnerable to the effects of alcohol on the liver. The liver is particularly susceptible to alcohol-related injury, as it is the primary site of alcohol metabolism. When the liver tries to break down alcohol, the resulting chemical reaction damages its cells, which results in inflammation and scarring. Moreover, alcohol can damage the intestine, allowing the harmful toxins released by the gut bacteria to get into the liver. A 2012 study published in BMC Gastroenterology reports that serum gamma-glutamyltransferase levels were undoubtedly increased in current drinkers and in heavy daily drinkers, as well as in heavy lifetime alcohol drinkers. This was confirmed through liver function tests. 2. Affects heart health. The high sugar and calorie content of alcoholic drinks is not good for your heart, as it can cause high blood pressure, heart problems, and strokes. A 2006 study published in Clinical and Experimental Pharmacology and Physiology reports that regular intake of alcohol elevates blood pressure. Globally, the contributable risk for hypertensive disease from alcohol is 16%. Alcohol drinkers are also at risk of low-density lipoproteins, LDL, or bad cholesterol, building up on the inside of the arteries and forming plaque. This plaque can restrict blood flow to other parts of the body and increase the risk of a heart attack and stroke. A 2001 study published in Alcoholism, Clinical and Experimental Research highlights the influence of alcohol intake on risk for increased LDL cholesterol in middle-aged Japanese men. According to the National Institutes of Health, drinking moderate amounts of alcohol can protect the hearts of some people from the risks of coronary artery disease. But this benefit transforms into an adverse health effect once the drinking habit crosses the moderate level. 3. Increases cancer risk. The National Institute of Alcohol Abuse and Alcoholism analyzed more than 200 studies and concluded that alcohol intake is linked with increased risk for cancers. Alcohol, ethanol, is converted in the body into a toxic chemical called acetaldehyde. This chemical damages DNA and stops cells from repairing this damage. It also weakens the immunity and influences free radical formation. A 2000 study published in the European Journal of Clinical Nutrition reports that high intake of wine, the most commonly used alcoholic beverage, increases the risk of esophageal cancer. There is also an association of heavy alcohol intake with increased risk of pancreatic cancer, according to a 2012 study published in the Annals of Oncology. The risk is even higher in people who drink as well as smoke heavily. For women, the risk of breast cancer also rises with alcohol use. A 2015 study done by the Plataforma Sync confirms that alcohol intake increases the chances of developing breast cancer. This risk quadruples with the intake of each daily glass of wine or beer. 4. Damages the brain. Alcohol is a potent neurotoxin and its high intake is bad for your brain health. According to the National Institute on Alcohol Abuse and Alcoholism, high alcohol intake may accelerate normal aging or cause premature aging of the brain. The toxins in alcohol interfere with the brain's communication pathways and can affect the way your brain functions. These disruptions can lead to a decrease in the brain's processing speed and efficiency. It can also cause memory loss, poor concentration and cognitive decline. A 2014 study published in Neurology reports that excessive alcohol consumption in men was associated with faster cognitive decline compared with light to moderate alcohol consumption. Plus, alcoholism leads to two common nutritional deficiencies, thiamine, vitamin B1, and magnesium, which are important for brain health. Thiamine deficiency causes decreased mental alertness, confusion, memory loss and decreased coordination, while magnesium deficiency is associated with depression, confusion, disorientation, apprehensiveness and irritability. 5. Leads to pancreatitis. Prolonged heavy drinking can result in progressive and irreversible damage to the pancreas gland. Alcohol causes the pancreas to produce toxic substances that can eventually lead to inflammation and swelling of the blood vessels in the pancreas. This can even affect the digestion process and the body's ability to regulate blood sugar levels. A 2008 study published in the American Journal of Epidemiology confirms that high alcohol intake was associated with increased risk of pancreatitis. Further, the study indicates that gallstones slightly temper the association between alcohol and pancreatitis. A study published in the JAMA and Archives journals in 2009 indicates that 5 or more drinks per day significantly raise the risk of chronic pancreatitis. In addition, smoking is an independent, dose-dependent risk factor. Another 2013 study published in the World Journal of Gastroenterology sheds light on the fact that heavy alcohol consumption may increase pancreatic disease risk, most likely potentiating the effects of other risk factors, such as smoking and poor diet. 6. Causes infertility. Heavy drinking is linked to fertility-related problems in both men and women. The toxins in alcohol increase the length of time it takes to conceive and even reduces the chances of having a healthy baby in females of childbearing age. In fact, health experts recommend that women trying to have a baby and pregnant women should not drink alcohol at all. Alcohol intake during pregnancy increases the risks of low birth weight, preterm birth and even fetal alcohol syndrome.